Okay, good evening, everyone.
Good evening. Good evening.
Okay, so I hope you guys have a great day and ready to start this class. Remember, we're almost over with this class, so tomorrow will be the last day of class, I believe, for this module. And then we're gonna start another class on Monday, another module. So time goes fast. Oh, time goes pretty fast. So next thing you know, you're done with this program. You move into the internship and start searching for a job. So that's how it goes. Okay, so I believe we still have like a minute. Any questions about what we have already covered from this chapter or anything else? Any other inquiries, whatever you guys need to know? And if I have the answer, I will be more than glad to give it to you. And if I don't, I will look for the answer, I guess. So that's basically what it is. No questions? Okay. So we're going to continue with the digestive system. Remember the digestive system. Let's do a little recap of what we have covered already. So we're talking about all these structures, remember the anatomy and the functions, the physiology of the digestive system. As the word implies, remember digestive means digestion, means processing all this food that we eat. And then taking all the nutrients out of this food in these different
Hi, I'm
structures.
sorry.
Go
Excuse
ahead.
me. I'm getting off for work, so I'm gonna be late, like 15 minutes to log back to school, okay?
All right, that's fine. Thank you for letting me
Okay.
know.
You're
Okay,
welcome.
no problem. So that's basically what it is. So all this process of this food, whether it's in the mouth, remember that is the mechanical digestion. Then it moves to these tracts all the way down to the stomach, passes through the pharynx, then it goes to the stomach. But remember, during the process of mechanical digestion, the teeth is going to be doing its work because it's going to be masticating. It's going to be chewing these food, these solids to make it smaller alongside with the salivary glands that provides the saliva that moist these foods because sometimes they are completely solids. As I mentioned yesterday, can you imagine eating bread or toast bread that is so difficult to swallow? Now it's going to get moist because of the salivary glands. We can make a bowl that's called a bolus, and we're going to send these all the way down to the alimentary tract with the assistance of the tongue. Remember that the tongue is going to push this food all the way down. Now, these tracts are going to have some movement. Remember, that's going to call the peristalsis. This propelling movement that allows the food to move on all these tracks in this fashion, a wave like that's peristalsis. Then it moves to the stomach. The stomach starts breaking down this food with the assistance of all these acids, the gastric juices. Then start this movement that is called, remember, side to side. So it's going to start doing this circulating movement. And that's how it's going to help to break down even further this food with these chemicals, which are these acids. Pepsin, hydrochloric acid, lipases, amylase, protease, all these enzymes that helps to break down the food even further so it can be absorbed. So when it moves to the small intestine, so the food leaves the stomach, moves to the next tract, which is the small intestine. In this area, the pancreas is going to produce some pancreatic juices, and it's going to be sending these juices to the small intestine to help to break even further these particles, these molecules that are too big to be absorbed through the layers of the small intestine. So that's how all these works. Then whatever is going to be absorbed is going to pass through the walls of the small intestine to the blood flow. Whatever waste is there is going to pass through all these tracts. Small intestine, remember, that is divided in two sections. The proximal one, the one close to the stomach, is called the jejunum. The middle section is called the duodenum. That is the proximal part, the one that is connected to the stomach. Then it moves to the middle one that is called the jejunum. Then it moves to the last part, to the distal part, the part that is connected to the large intestine, which is called the ileum. Whatever material leaves the small intestine, now it is going to be waste. It's going to be the fecal material, feces. It's going to be drawn all the way down from, the ascending column, the transverse column, the descending column to the rectum through the anal canal. So that is what we covered up to now. So we went through all the structures. This is how it works. So remember, the three major functions of the digestive systems are digestion, absorption, excretion. So digestion, mouth and stomach. Absorption, the small intestine. Excretion, the large intestine. So we got to the bottom part of the digestive system. So that's how it works. I'm not gonna go into little details because we're not repeating the class, but there are other structures. Remember these accessory structures like the teeth, like the pancreas, like the gallbladder. So remember, talking about the salivary glands as well, that we have three pairs of salivary glands, and the parotid glands are the largest one. So that's basically what it is. So very important, they produce amylase. Remember, this is the enzyme that breaks down carbs, carbohydrates, glucose, starches. The same starch is the glucose that comes in the foods that we eat. So that's basically what it is. So then we talk about this lower esophageal sphincter. Remember, the esophagus, the part that connects the esophagus to the stomach. And it's very important clinically because whenever we develop this very common condition that is called heartburn or esophageal reflex or acid reflex, whatever you want to call, it is caused by an issue that happens with this sphincter, lower esophageal sphincter, that's not closing as the stomach is doing the digestion. So food content is going to regurgitate. Regurgitate means goes backwards. It goes back to the esophagus instead of going to small intestine and so on and so forth. That's basically what it is. So remember that stomach produces these stomach juices or gastric juices. We already talked about pepsin. We're not going to talk about how it's converted, but pepsin, lipase, and hydrochloric acid. Remember, hydrochloric acid is the most common acid or enzyme produced by the stomach. Here we saw the most common condition, heartburn or acid reflux or esophageal reflux. The pancreas produces two very important hormones. Remember, it's an endocrine gland, an exocrine gland as well. So let's say that they give you a question. Which of the following glands is considered a mixed gland? The pancreas is, because it produces internal hormones and some enzymes that aids with digestion. So that's basically what it is. Remember, the pancreas produces insulin and glucagon. And these two hormones are the ones that regulates glucose. Whether giving a little glucose if we don't have glucose, or regulating the excess of glucose, because we don't need too much glucose running into our blood system, because that can cause diabetes. So we talk about the pancreas secreting these hormones. We talk about them, amylase, lipase, and protease. And each one is in charge of breaking down whether glucose, whether fat, or proteins. Then we talk about the liver. Remember, the liver produces bile, and this is the largest internal organ. Then we talk about the gallbladder. Remember, the gallbladder do not produce bile. It stores bile that is produced by the liver. Very important that you remember that. So we talk about hepatitis. Remember, this is a condition of the liver, which is caused mostly by viral infection, which is the most common hepatitis B or alcohol consumption. Remember, if you drink too much alcohol, these heavy liquors, you are going to develop hepatitis. So you put yourself at risk for this. Talk about gallbladder already. We talk about the small intestine that is divided in these three section regions, the duodenum, the jejunum, and the ileum. And then the large intestine, which is the last part of the digestive tract, which is, remember, the one that carries this waste out. And is divided in the ascending column, transverse column, descending column, then the rectum and the anal canal. So that's basically what it is. So knowing, at least having an idea of what is the digestive system made of, you are going to understand what happened in each one of these structures. Once again, we're talking about anatomy and physiology, anatomy, all the structures that these systems are made of, and what is the function of those? That's the physiology. What is it that each one of these structures do? What is the function? What are they there for? And what happens if they don't work properly or if they get damaged? What are the consequences? What are the conditions? So that's basically what is important. So we were talking about here, this is the last part that we left off, the large intestine. So remember, very important question for the large intestine. It's not just that is the last part of the alimentary canal that carries the wastes, the feces, but also then it contains the appendix. Remember, the appendix, it is located within the large intestine. within the colon. Large intestine, colon means the same. It's just that when we want to divide it, we said, okay, the parts of the colon or the large intestine are the part that connects to the small intestine is called the cecum. That's the beginning of the large intestine. And that is the parts where we are going to find the appendix. Remember, the appendix is this little tiny structure. This structure doesn't do anything, doesn't have any functions in our body, but it does cause us problems. Because when stools accumulate here and we do not drain these stools, let's say that you get impacted, meaning constipation, your entire intestine, you're not passing the stools when you're supposed to. So the entire colon is going to fill with stools. And because they remain too long within this structure, this is a living structure, and leaving something that it is waste for too long inside, these wastes are gonna decompose. They're gonna rotten. Think about this. Leave a piece of meat or poultry outside the refrigerator or the freezer for that matter. It's going to spoil because there is no longer circulation going through it. There is no oxygen being provided to this tissue, so it decomposes. Now, can you imagine that with waste now? This is waste. All this fecal material is going to deposit it right here, and it rottens. And it causes bacteria to be produced. And if that happens, that can cause problems to the large intestine. They can irritate your large intestine. You can develop inflammation of that area. So now we have to go to the doctor to get medications. These feces, when they accumulate right here within the cecum, they're gonna infect this little tail right here, which is the appendix, and the appendix is going to get irritated. It's going to be inflamed. It's going to swallow, and it's going to become very big. It's very small and can become really large. And if it's not treated immediately when this happens, this is going to blow. It's going to break down. It's going to explode, if you will. And all these feces and all these bacteria is gonna seep inside your abdominal pelvic cavity. So you have bacteria everywhere. Now you have 24 to 72 hours to get stomach lavage, medications, hospitalized. Otherwise, you're gonna die. So it's very serious having appendicitis. And usually the treatment is to remove it, to extract it. That's what is called appendectomy. So it's very important. For that reason, they ask about appendicitis. Where is the appendix located? What is the condition that develops if the appendix gets sick? Let's put it that way. It's called appendicitis, inflammation of the appendix. And what is the treatment? Appendectomy, excision, surgical removal of the appendix. It has to be removed. There's no way that we're going to fix something so small and something that doesn't do anything good for us. It just causes us trouble, so it has to be removed. So let's talk about these other conditions that happens to the digestive system, something that we have not talked about much, but we will discuss that. So I just did a little recap of what we covered yesterday, just to refresh your minds, to make sure that you do understand how all this works. Okay, so let's talk about this last structure, which is the rectum, and then the anal canal. So we're going to talk about that. So in this part of the rectum, just like at the entrance of the esophagus to the stomach, we have sphincters. At the end of the stomach, we have another sphincter, because remember, the stomach has to be locked in. All the food that we eat needs to be closed out. The lower esophageal sphincter should not open when digestion is taking place, because content is going to go to the esophagus and cause us the acid reflux, the heartburn, right? And it should not be open on the lower part, the pyloric sphincter. Why? Because then we're going to develop diarrhea. So when this process, think about your blender. Think about you are processing something, juice in a blender. You don't want to overload your blender, because then it's going to pull the cap or the cover of the lid off. So the same happens when you eat too much. Food is going to go over. There's no place where. So it's going to go back to the esophagus or to the small intestine before it's being processed. So remember, that's called diarrhea. The other one can be vomit. You can actually regurgitate all these. So that is how it happens. So it has to be closed on top and on the bottom. So those sphincters closes. These are muscles. They just close. So we have two sphincters, one internal sphincter within the rectum, one external sphincter within the anal canal. See, the anal canal is a ring, it's a muscle, in a circle made of circular muscle. So can you imagine if we want to go to the bathroom and we encounter ourselves riding car, riding the train or the bus, or just walking in a place when we cannot use a bathroom or we don't have a bathroom available, and you wanted to move your bowels, you wanted to go do number two. Can you imagine if we didn't have those sphincters, stools will come out right away. We can't just kind of constrict our muscles and say, oh my God, this is not going to happen. Yeah, we still have a little time to look for a place so to do something. Unless it is diarrhea, we cannot stop it. But if it is just that you want to go, you still can buy some time because of these sphincters. These sphincters tightens up, and you ask them to tighten up, and you said, I don't want to go, and you kind of squeeze your gluteus area. You know what I'm talking about? So you do not defecate yourself. So these sphincters are very important. Remember, we have an internal sphincter and external sphincter. Internal means inside. So inside the rectum, I'm going to mark right here, we have this sphincter right here. This sphincter right here. These are internal, see? Sphincters. And on the outside, so it's not inside the tract, it is outside the tract. We are going to have this one right here, which is the external. This is not a good color. Let me see. Let's put this one. we're going to have right here an external sphincter, psi and psi, see? So this one acts first and doesn't allow all the stools to pass down. See, the stools right here, they are not going to pass. They are stuck right here. And they don't allow you because you have this sphincter right here that tightens. Right here is closed. It's like a ring right there, not allowing the stool to pass. So when you want to go to the bathroom and you're ready, then immediately your brain is going to send signals and this is going to open up and stools are going to pass because here we have another, remember, sphincters, and those sphincters are the one that closes this area that we have a ring right here within the anal canal. So both of these sphincters going to open, stools is going to pass down. That's basically what it is. So damage to the nervous system can cause these sphincters not to close. So stools would go out without even thinking. Think about people who have problems with the sphincters of the urethra, the urinary tract, which we will be talking the last chapter of the urinary system. So here we're talking about stools. So stools pass it only when the sphincters opens. Think about the valves of the heart. That's exactly like it is. Like the sphincter right here on the stomach and the esophagus and at the end of the stomach. They close when something is going on inside. And when it's finished, it opens to allow the content move to the next level. So that's basically what it is. So this is important because we are going to talk about some problems that can occur in this area due to constipation, due to the problem of having not being able to pass the stools. So let's see. Now that we talk about the rectum and these structures, the internal and the external sphincter. Now we're going to see certain conditions of the digestive system. So let's talk about diverticulosis. See, there are two terms. Sometimes we kind of mix them up. They are not the same. These conditions are affecting a part of the large intestine. Is the same area that is being affected, but in two different forms. So the verticulosis, well, let's talk about diverticulitis because it's a lot easier for you to understand. Diverticulitis means inflammation of the diverticula. Now, what is the diverticula? Let's move here. So whenever we have this area right here, the descending column, all this area from here to here is called the diverticula. So if it is inflammation to the layers, to the lining of this area, is called diverticulitis. Now, what is diverticulosis? Because remember, for those who took medical terminology with me, you know that itis means inflammation. Osis means an abnormal condition. So let's move right here again. So itis is inflammation of what? Of this structure, the lower part of the colon. inflammation. Here, oocyst is not inflammation. It's an abnormal condition of what? Of this lower part of the descending colon. So that's basically what it is. Now, diverticulosis is nothing else than growths. The mucous membrane forms like these pouches, like these herniations. So let's go back to this image, and we are going to do a little something right here so you can see what is going on. So let's say that this is the normal shape of, right here, the descending column. So now, instead of having this normal shape, this descending column is going to form these pouches. See? These pouches right here. And what's going to happen, that stools is going to go there, but it cannot get off. Because it's like herniations that happens because this lining of the stomach on the lower part becomes very weak, very thin, the walls. So it forms like herniation, like pouches and stools deposits here. But then the stool is supposed to go down, but it doesn't. And when that doesn't happen, that creates infection right here. Creates infection, and the whole infection spreads around this area. So now I'm going to have an infection right there. And that infection causes this lining, the mucous membrane, to bleed. So when you have diverticulitis, you're going to feel like you have this lower part of the descending colon that is swollen, and you're going to feel it from the outside. So you feel like you are full, like your stomach is distended. Distension means that it feels like a balloon, like it's full of air, but it's actually the intestines that are full of, you know that, right? Feces, stools. So that causes damage to the lining of the large intestine and make the patient bleed when they pass the stools. Because not all the stools are going to go into the patches. That's what causes them not to leave, but there are more stools around here. So constipation is a problem. So that will be diverticulosis. It will be a condition, an abnormal condition of the colon, particularly the lower part that is called the diverticular. And the difference between diverticulosis and diverticulitis is diverticulitis only causes inflammation of this descending colon that is called the diverticular. Whereas diverticulosis means bleeding because it's a weak, this membrane, these walls of the large intestine on its lower part becomes very weak. So start bleeding. So we're going to find blood in your stool. In diverticulitis, we don't find blood in your stool unless something else is going on, but not because of that. So that's basically what you need to understand here with diverticulosis and diverticulitis. Now we have inflammatory bowel disease. Now, inflammatory has to do with swelling of the walls of the layers of the large intestine, right? So we have two conditions that are similar in nature, but we have certain differences. So here we have something that is called ulcerative colitis. Think about this. Colitis is inflammation of the colon. So that's what is called inflammatory bowel disease. So ulcerative colitis means that there is an inflammation of the colon and any part, see, any part of the colon, because this is the entire thing is the colon, inside and the mucous membrane. So you have inflammation, but not only that, you're gonna have ulcers being produced there. So think about this. If you have ulcers, you have damage to the lining of the skin, you're gonna bleed. So you're gonna pass stools and you're gonna bleed. You're gonna have very bad abdominal pain. Like the abdominal pain that the females have when they have the premenstrual period or menstruation, whatever it is, before or within. So it's a very, very bad pain. So patients usually end up in emergency. So that is ulcerative colitis. They develop diarrhea continuously, a lot of pain, and we see blood in their diarrhea. So that is ulcerative colitis. Now we have another one that is called enterocolitis, means is only within the colon, only this part that we see here. So pay attention because those are the big differences. Colitis, ulcerative colitis are ulcers to the colon and inflammation only to this area, to the entire colon, the large intestine. Whereas Crohn's disease, the probably you heard about it, Crohn's disease affects the entire digestive system, can affect the throat, can affect the esophagus, the stomach, the small intestine, the large intestine. Is in an inflammatory condition. So you have segments. It's not that the entire digestive system is going to be swollen or inflamed. No, segments of the digestive system. And that's really bad because the digestive system in each section has certain functions. And if you have inflammation or part of the digestive system in different tracts, it's not good. So that's what we call the Crohn's disease. It is more serious than ulcerative colitis. Now with Crohn's disease, when you develop this diarrhea and the pain, there's no blood present. Remember, ulcerative colitis, you have ulcers within the mucous membrane of the colon. So then you're going to bleed and you're going to have diarrhea and very painful diarrhea, very painful abdominal pain. Crohn's disease, you're going to have all of them, but without blood because you don't have ulcers. And the inflammation can happen to any part of the alimentary tract, starting from the mouth to the anal canal. So those are the things that are very, very important to mention. So I already mentioned appendicitis. So we're gonna kind of leave that out. Remember inflammation of the appendix. I spoke to you a lot about. This is a very, very common condition, and it can be very, very. So hemorrhoids. So probably you heard about hemorrhoids. This happens to the lower part of the rectum and the anal canal. That's what hemorrhoids happens. It says right here, lowest part of your rectum, internal or the external part. Remember? So if you have internal hemorrhoids, you're probably not even going to notice it. But the problem is when you are going to move or you're going to pass your stools, or you're going to have a bowel movement, you're going to be having difficulties doing so. Because what you have is right here, you're going to have these veins that we have around here that swell up. It's the blood vessel that swells up with blood, of course. So they're going to block right here the passage of the stools. And if they pass, they make you bleed. So you're going to be seeing blood on top of the stool. Ulcerative colitis, you're not going to see the blood on top of the stool. It's going to be hidden within the stool. So we have to do a stool analysis. When you have hemorrhoids, you are going to see physically the blood on top of the stool. So that's basically what it is. So hemorrhoids are very, very troublesome. Now, if you have external hemorrhoids, meaning the ones right there in the anal canal, they're going to be very, very painful. Because we have all these terminal nerves within this external sphincter that makes up the anal ring, the anal canal. So why do we develop all these hemorrhoids? Constipation. Constipation. When you strain yourself, meaning you make a lot of effort to get the stools out, that causes these external blood vessels or internal blood vessels in the rectum and the anal canal to swallow, just like the varicose veins. They swallow and they become larger than the varicose veins. And they can bleed. They can become a very, very uncomfortable, embarrassing situation. So remember, constipation. What causes constipation? That we're not drinking enough fluids, that we're not adding to our diet enough fiber, that we're eating too much of flavors, too much all these rice and pasta and all those things that causes us to have very solid stools. So that's basically what it is. So hemorrhoids are very common. Remember, hemorrhoids are nothing else than swollen veins. Remember, we have the veins right there on the surface of these linings, these layers of these structures, and we try to push all the stools out and make a lot of effort. It takes a long time in the bathroom trying to get it out. Well, the effort that we do, the straining that we do, causes these veins to swell and eventually bleed. Any questions about diverticulosis, diverticulitis, any of these inflammatory bowel disease, for instance, talking about here ulcerative colitis, Crohn's disease, or this condition that happens in the rectum and the anal canal that is called hemorrhoids. So hemorrhoids is not going to kill anyone, but it's very troublesome if it happens to you. Last but not least, let's talk about colon cancer. Remember, colon cancer is one of the most common cancers here in our territory, the United States. It says right there that there is the fourth most common cancer. Colon cancer is very, very common. So remember, these cancers are due to the fact that within the colon we have these wastes, the stools. And when they do not pass fast after we eat or something like that, we have to go to the bathroom. We need to go to the bathroom to move our bowels, remove these wastes at least twice, 3 times per day. But if you don't do it, 3 days pass by, you haven't moved your bowels, you have constipation right there. That is the diagnosis. 3 days without moving your bowels, going to the bathroom, having a lot of trouble passing your stools, that is it, constipation. It is time to add lots of fluids to your diet, or enough fluids, because usually we don't drink enough fluids, and fiber. And if you are not adding those to your diet, then you have to use supplements. Something that helps, like these stool softeners. Because otherwise, that's going to cause some trouble. Remember, eventually, the lining of the stomach is going to be damaged for any of these conditions. Now you are prone to develop these malignant cells within the mucous membrane. That causes cancer. Now, one of the good things about these conditions, particularly cancer, is that we have a screening test that is called colonoscopy. Remember, colonoscopy is the visual examination of the colon. And this is done after 40 years old. Some of the times 45, 50. All depends on the history of the patient. Remember, if a patient never, in patient's history, family history, you don't have colon cancer or any other types of cancer in the family, we delay a little bit these exams, doing the colonoscopy after 50. But if you have a family member that have suffered cancer or other types of cancers, then we're going to start earlier. Because we're going to make sure that we're going to capture, that we're going to cut these tumors before they grow, before they become a problem. So remember, screening test is just a test that we do to find out whether you have something before it becomes a serious matter. Unfortunately, we don't have screening tests for everything. See, pap smear, that's a screening test. Mammogram, that is a screening test. So whenever we want to evaluate something before it becomes a problem, that's called a screening test. This is like a test that is done in preparation to find something. It's not that you have it. It's that we need to figure it out or find out or evaluate you before it happens to you. So that is colorectal cancer. These are the most common cancers, whether the rectal cancer, whether colon cancer. These are the most common of the digestive system. You can develop cancer of your stomach, of course. Cancer of your esophagus, true, but they are less prevalent, or the incidence of these type of cancers are not as common as colorectal cancer. So that's basically what it is. So the cancer of the colon, remember, and it has to be evaluated through a biopsy. So when we do a colonoscopy, remember back in the days, I mentioned to you that sigmoidoscopy was done, but the sigmoidoscopy only reaches this area right here. So if we do a sigmoidoscopy, it's going to be a scope that is going to put through this area. No, this is not going to show anything right there. Let's put it blue. So it's going to go right here through this area up to here, to the sigmoid. That's it. What about this part right here? Well, then they switch it. It came another doctor that says, wait a minute, that was an oncologist. We are checking only part of the column. Because remember, that's assuming that your digestive system is working properly, that you are removing the feces, the fecal material normally. You go to the bathroom to do number 2 twice, 3 times per day. So every time that something accumulates right here, it's drained. But what about for those who develops constipation or other conditions that doesn't allow this peristaltic movement and stools get stuck around here? So what about this area? So for that reason, they came out with colonoscopy, which is the entire colon is going to be viewed. And if we find any growths inside, which are called polyps, we are going to remove a little piece of those polyps. We're going to send it to pathology. And then when we get these analyzed, we're going to get the diagnosis. So remember, cancers are diagnosed by biopsies. You can't just say, okay, you have cancer now. How? Just because you found polyps, polyps are not always cancerous. You have to evaluate them. Having polyps, but themselves does not imply that you have cancer of any kind. So we have to evaluate them first. And then that we have those analysis, those results, review by a pathologist and a specialist on diseases, then we are going to determine that this patient have this type of cancer. So that's basically what it is. And you know what it's about? So remember, this is a piece of tissue that is removed, send it to pathology, and then when the results comes in, they're going to tell us whether we found malignant cells within this tissue. If there is no malignant cells are present, this tumor is benign, meaning no cancer, no further treatments. There is nothing we can do to, we're not going to treat the patient for something that don't have. So that will be cancers. Okay. Any questions? We're done with this chapter. So I just wanted to make sure that we cover all these and, you know, nothing is left. Because it's important to know all this. Remember, these are very common conditions. And at least you're going to be familiar with some of the terms when the patient comes in and then complain about some abdominal pain, some diarrhea. You don't have diarrhea just because you ate too much or because you ate something that it was spoiled. No, it might be an infection that you have within your intestines, so we need to evaluate it, or any part of the alimentary tract. So that's basically what we need to do. Any questions? Otherwise, we're going to move to the next chapter. Very similar, because it's going to be the endocrine system. Okay. So move on. Let's talk about the endocrine system right here. What is my endocrine system? Do I have it right here? Yeah. Mhm. And this is it. Yeah. Okay. So this is the endocrine system. Can you guys see it on your screen? Yes. Do you see the new chapter?
Yes.
Thank you. Okay. So we're going to start by breaking down these medical terms. Remember, if you took medical terminology with me, you already have an idea. If you didn't, well, now you're gonna learn. And if you forget, then I'm gonna remind you. So this is a medical term. So cream means secretions, endo means internal, inside, within. So these are called internal secretions. So we are going to talk about these organs that we call glands that secretes something. So because it's endocrine, we already assume that these are glands. In glands, the secretions that the glands produce are called hormones. Just giving you a little overview of what we are going to be discussing during this class. So we're going to get into some terminology that is a little complex, if you will, because there are many terms that you're not familiar with. I'm going to do my best to use layman terms to see what is this gland probably you're not familiar with, but you're going to get to know the gland. I cannot change the name. But then I'm going to tell you what are the major functions. Actually, how do they work? Where do they work? Meaning they produce hormones and these hormones goes to different parts of the body to do certain functions. So that's basically what it is. Right? Kind of 3, 4 questions that might be arising on your test. I'm going to let you know. So that's basically how all this is gonna play out. So endocrine. So it says right here that the endocrine system is a collection of glands. I already told you these are organs, but these organs are called specific glands. Why? Because they secrete hormones. See? They secrete hormones. They are chemicals, of course, but they are not called enzymes. They are not called acids. No, they are called hormones. And what is it that these hormones are going to do? Well, these hormones are going to be sent to certain target organs. Target organs, target means the organ that need these hormones to do certain functions. So that's basically what it is. So if we have too much of the hormone, not good. And if we have deficiency of the hormone, not good either. So we need to be balanced. So that's basically what it is. So we're going to talk about these hormones that are going to regulate how other organs function. So I'm putting it on my own terms so you can understand this. So we're going to mention these organs, these glands, and they're going to produce certain hormones. The most kind of common hormones, we're going to discuss those. And what is the function? Where are these hormones are going after are being produced? So remember, all these systems work intertwined with the nervous system. So the nervous system has a huge role in every single structure in our body. If the nervous system doesn't work, nothing works. Think about the electrical sources that we have in our home. And most of the equipment, most of the electronics that we have or devices that we have in our home are electrical power. So how are we going to get our refrigerator to work if there is no energy? What about our stove? It doesn't matter. Sometimes it might be gas, but it needs to be time to be ignited by electrical. You don't want to go there and pull a match or a candle or I don't know, a lighter to turn your stuff on. Actually, I'm scared to do that. I don't like gas. So I just turn on the knob on my stove and it lights up. It turns on. I don't have to do anything else. So can you imagine where you're gonna charge your phone, your TV, all these electronics that we have at home? So the same goes with every single structure organ in our body. It is controlled by the nervous system. Remember the brain and spinal cord. So that's how it works. So all of these functions of every single structure in our body is controlled by the nervous system. Just because we don't mention it does not imply that this is happening. Because these hormones are going to be signal. See, whenever an organ needs these hormones, the body needs to send a signal. It's like having Wi-Fi. And you're walking around here and there. If you don't need your Wi-Fi, if you don't need to send a message, you're not worried. You carry your phone, it doesn't matter. But whenever you need it, you're going to open your phone and says, oh, I'm going to message someone. I'm going to call someone. Wow, I don't have Wi-Fi. I don't have this service. I don't have a signal. Not good, right? So this is how all these chemicals, these hormones works. We're going to talk about these glands that produce certain hormones and what is the target organ, meaning where are these hormones going to? Are all these hormones goes to the same place or going to a specific area? Well, they go to a specific area. Think about the trains and the train station. If you go to Manhattan, you take certain train and you get off in certain stop. It's not like you go to Manhattan and then you decide, oh no, you know what? I'm going to take the train to Long Island. It doesn't work that way, right? So these hormones, these glands are like the trains, like the train station. And then from there, you're going to send these hormones, these trains to certain destination because that's when it's needed. That's how it works. So we're going to talk about these glands. Remember, they are organs. All of the structures that we have in our body, most of them are organs. But some of them produces hormones. We call it glands. But if they don't produce hormones, we don't call it glands. All of us went to study something, but I'm not going to call you a doctor. You didn't study medicine. I'm not going to call you an attorney if you didn't study to be an attorney, start the law. So we're going to call you who you are, depending what profession you have. So that's basically what it is. Moving on. So I mentioned this term, these two terms I have mentioned them several times, but one more than the other. So the endocrine system helps to control the following processes or functions: growth and development. Well, think about this. Our body needs certain chemicals that are going to assist these organs to help us grow. Think about from the moment that we were conceived, so to speak, immediately these two cells got together. See? Sperm, egg, oocyte, sperm, ova, sperm get together, fertilize. But it was two little pieces, two microscopic pieces. Now they're going to start growing and developing. Because now, after you have two cells, two sex cells getting together, now we're going to form a body. But it needs all these structures within. So it grows, and develops. So it starts from a little fetus, and then it's born, and it starts growing, developing, goes from all these stages. See? So we have these hormones that assist the body to do this. Homeostasis. Remember, this question will be in your exam 100%. What is homeostasis? Internal balance. Remember, everything that it is inside our body needs to be balanced. Only needs to have what the body needs. So certain amount of water, certain amount of proteins, minerals, fat, carbs, vitamins, hormones. We need to have certain amount of these chemicals, all these electrolytes, sodium, potassium, magnesium, chloride. All these has to be balanced. So we have tables that as a guidance, as a parameters of what is considered normal for each one of these chemicals in our body. So based on those tables, we determine whether you are above normal, below normal, whether you have too much or whether you are deficient. Now we have to regulate that to get homeostasis, balance it out. So that's basically what it is. So the only thing that you need to know about homeostasis is internal balance, how things are balanced. Know the definition. Next, metabolism. Now, metabolism is this, that let's put it this way in simple words. It's like this digestion, but inside the cells. Remember, we talk about catabolism and anabolism when we were talking about the cells. That's called metabolism. So metabolism happens when we have a big piece, while inside the cell is going to be a very small, but it's big to pass through the cell membrane because the cells are microscopic. So anything that goes through the cell has to be microscopic. So it goes through a process of metabolism. We have a particle, a molecule that it is too large, like a protein molecule, a glucose molecule, fat molecule, because those are the molecules that are the largest. So we have to break them down in small parts. That's called catabolism. Then, when enter inside the cell, they pile together, they go back again and form the entire molecule. That is called anabolism. This process of catabolism and anabolism is called metabolism. So this is a chemical process inside the cell. So just know the definition. A chemical process inside the cell. Whatever happens inside the cell to break down, to consume, to generate energy, to remove the wastes is called metabolism. Outside the big pieces, we call it digestion. Because remember, the cell is a living structure, the smallest living structure of our body. Remember that I told you that the cell is going to be asked, what is the cell? What is the smallest living structure of our body? What is called cell. So when we talk about digestion inside the cells, what do we call that? We don't call it digestion. We call it metabolism, because digestion is on the big structures, the digestive system. Then we have another process that happens with our body, reproduction. These cells reproduces themselves. Remember the process of mitosis? One cell divides in two equal cells, and that's two cells, and two more, and two more, and two more. And that's how it works, reproduction. Or going back to the sex cells, but includes both. These hormones or whatever chemicals our glands are producing also, they respond to stimuli. Now, once again, I already mentioned that's like the nervous system. So whenever part you feeling that it is hot, immediately the stimuli of heat, high temperature, when it's cold or hot, is going to send a message through the skin, through all the nerves in the skin, to the spinal cord, to the brain, and part of the brain is going to send an answer. What to do, how to protect our body. Well, the same is going to happen to these hormones. An organ that needs this hormone is going to send a signal to this gland. Hey, can you send me some testosterone? Can you send me some estrogen? Can you send me some progesterone? Can you send me some growth hormone? Can you send me some insulin, some glucagon? We're going to talk about all that. So that's basically what it is. So our body is intertwined with all these systems. One system doesn't do all the services. Think about a company. When you have different people doing different tasks, one person is not going to run a company. Well, your boss or whoever is sitting over there in the big chair, well, he's paying us, so he's he's controlling the company, the financial. But who's doing all the labor, all the minor things? Us. So that's basically what it is. So we need to depend of other organs. That's why when one organ or system start failing, affects other systems. This is like the domino effect. If something goes wrong with this, then something else start falling apart as well. This is like when you are kind of, in a bad situation. You lost your job. Now you have all these bills piling up. So everything accumulates right there because something is not working. Well, literally, you're not working, right? But something is not functioning. So that's how it goes. So these hormones helps assist all the organs. So all these functions that I mentioned already can take place. Other than that, nothing is going to grow. How cells are going to grow if we're not having enough nutrients? Not, not going to happen. If you are not having this hormone that is going to trigger me to produce sperm, you to produce the eggs, well, it's not going to be growth or reproduction. It's not going to be anything. So sometimes you can have all your organs normal, but they're not producing what they're supposed to be producing. Because your organ, the one that is going to accept that chemical, is okay. But the one that is sending you these chemicals is not producing it. So then you're not going to be able to. So that's basically what it is. So you have a restaurant, but you don't have anyone who's going to deliver, who you're going to buy the supplies that you need, the products that you need. So how you are going to prepare anything in your restaurant? Not possible. So that's how this chapter is very, very important, because from this chapter depends most of the functions that our body needs to accomplish. Of course, we need the assistance of other systems. It's just that each system has something. That's why we have hospitals. And what is a hospital? Oh, we have a place when we have all these different specialties. It's not the same going to your primary care physician. What about you have problems with your heart? Oh, they have to send you outside to a cardiologist. What happens in a hospital? You have all of them. You have the cardiologist, the ophthalmologist, the dentist. You have the endocrinologist, the GYN doctor, the obstetrician, the psychiatrist, the psychologist, the surgical doctor, the geriatrics doctor, the internal medicine, the general medicine, the family practice medicine, and orthopedics, all those specialties. Of course, there are more. That's how it works. So our body is complete, but we need all these different specialties, these different organs, these different systems to help us out to complete all these functions. That is how it works. Any questions about this endocrine system functions or characteristics or processes? I'm trying to give you as much as I can, give you real life samples so you can put it together, because this chapter has lots of complex names, as I said before. But I'm going to try to make it as easy as possible for you to understand, using these layman terms. Because that's what I want you to do, to at least you understand what is the process, how it works. Not just reading from the slide and, well, possibly, I'm pretty sure that you can read better than me. So, okay, so here we have the endocrine glands. Most importantly, location for now. So look at the image, and we are going to have certain glands right there that we are going to mention. It goes from head all the way to the pelvic area. So these are glands. And why do we call glands? Because they produce hormones. So let's start with these ones right here within the brain, because that's important. We are going to start with the pituitary gland. Now remember, I'm not going to talk about each one. I might mention it then. Here is functions because they are very important, but I'm going to focus on the ones that is really, really important and it might come out on your exam. Everything else, yeah, is important. Well, everything is important in our body, but we are not going to cover every single detail. So this is the pituitary gland. It is located right here within the base of the brain. The pituitary gland. Right here, we have it on the side. It's written. The pituitary gland. Later on, we're going to talk about how important it is, the pituitary gland. Then we're going to have, I didn't list it right here on the left side, or the right side, if you will. Well, that's the right side for you. It's my left side. The pineal gland. I will mention something about it because it's kind of important. Not as important as the other ones, but you know, they have their level of importance depends on the functions that they accomplish within our body. The pineal gland. We're going to focus on the thyroid gland, which is right here by the neck. We have the thyroid and the parathyroid. They sound familiar, they sound alike, but I'm going to tell you the difference and where are they located. So pay attention to the location because sometimes they don't just ask about what hormones are produced within these glands, but it is location. So this gland, it is located within the brain. Oh, the pituitary gland. Yes. Because these are the major glands. This gland is located in the anterior part of the neck. Oh, that is the thyroid gland. Pay attention to this because these are a cues for you to know. We're going to go over it. It's written on the next chapters, but I'm going over and then now that I have the picture right here, so I don't have to go back and forth. So this are is located in the anterior part of the neck. So that's called the thyroid gland. Now, this gland is located within the thyroid gland. Oh, the parathyroid gland. See, because it receives almost the same name. We're going to see it later on. The thymus gland. This gland is located right there in the chest area, in between the lungs. But just the fact that they're gonna ask you that is located in the chest area, you should know that this is the thymus gland. Later on, we're gonna discuss what are the functions of these glands. What is it that they do? What they produce? And where are they going when they are released from these glands? Where is the target organ? Meaning, where are they going after? Then we're gonna have a couple of small glands. They are called the adrenal glands. See, the adrenal glands. This is question for exam as well. So they said these are the two glands, whatever, they give you all this runaround wording, but no worries. These two glands are located on top of each kidney or above the kidneys. These are the adrenal glands. That's how they phrase or paraphrase the questions. So don't look at every single detail. Focus on one or two words. Glands located on top or above the kidneys. I know that this is the adrenal glands. That's it. It is located in the anterior. It is located by the neck. I know this is the thyroid gland. They are within the thyroid gland. This is the parathyroid gland. So that's how it works. Then we have the pancreas. Yes, somebody's gonna ask me a question. No, come on, don't be shy. Then we have the pancreas. And now the pancreas is located in the abdominal cavity. But they're not gonna ask you where the pancreas is located. They're gonna ask which hormones are produced within the pancreas. And then you're gonna look for insulin, because usually it's just one hormone that they ask, because it's the most important hormone that the pancreas produces, because it's the one that regulates the amount of glucose that it is circulating within the blood system. Remember that if we eat lots of glucose, lots of insulin needs to be released, because they're gonna go regulate. They say, it's too much sugar right here. So let's enter some of them inside the cell, whatever is needed. Everything else is going to stay within the blood system, because you have too much, then it stays within the blood system. So when I do a blood test for glucose, I'm going to find all these extra sugars in your blood. Shouldn't be there so much. Should have certain amount. So that's how we determine that. So the pancreas, remember, the pancreas produces two hormones, insulin, the most important one, and glucagon. Remember, glucagon is used when we do not have enough glucose in our body. We haven't eaten something. We are eating something that doesn't contain enough carbs. Well, because most of the things that we eat are carbs, carbohydrates, sugars, then usually we don't use it much. So that's basically what it is. But insulin, pancreas. Then we have the ovaries. We discussed that not long ago, and the testicles. Ovaries in females and testes in males. See the pancreas, now testes and ovaries. Here is supposed to be testes, because you know that, right? This is singular. Testes. Let me change it, because I don't want this to look bad. Testes is plural. Testes is singular. So there are two. So therefore, it's testes and ovaries. Ovaries is plural. Otherwise, we will say ova. We cannot say ovary. Ovaries are two. Right and left ovary. The ovaries. Anyways, so that's basically what it is. So we're going to talk about these particular glands, because they are the major glands of our body. Now, of course, we're going to have here like the hypothalamus. And we have another one. They didn't put it over there. The thalamus, the hypothalamus, and all that stuff. We're not going to get caught up with all these, because usually they are not asked and are very complex terms. And that's it. These other glands, what they do is they just control the pituitary gland. And the pituitary gland, as you're going to be seeing, is called the master gland, because the pituitary gland, this one located in the brain, is the one that controls every other gland. It controls all these glands, see? That's what it's called the master gland, because it controls all of them. So for that reason, we're going to focus on those who are kind of really important. I mean, I want you to know as much as possible, but we're going to focus mostly on things that, you know, I know it's easy to understand, to follow the track of all these structures and functions. Any questions up to now about what we have discussed? So let's start with the pituitary gland. I mentioned it already. So the pituitary gland is known as the master gland. Why? Because it controls every other single gland. So all the signals when something is needed anywhere in our body, this information is going to go to the thalamus, then to the hypothalamus, then to the pituitary gland. But we're not going to talk about those two first. So we're going to talk about the pituitary gland because these are questions for exam. So they're going to ask you, which of the following glands is considered the master gland? The pituitary gland. Whether you can pronounce it correctly or not, that is not the case. It is not an oral test, it's going to be a written test. So just look for pituitary and you're going to select that one. When we were talking about the cranial bones, I mentioned this. It says, where is the pituitary located within the brain? Where exactly? The sella turcica. The sella turcica. Sella means chair. It's a Turkish chair. So it looks like a chair, like this. This is the gland, and the pituitary gland is sitting right there because it's the master. It's within the sphenoidal bone. Don't worry. If you really want to know something, just keep in mind that it's located within the brain, but mostly in one place that is called the sella turcica or the Turkish chair. So that's basically what it means. Turkish, turcica, sella chair. So that's basically what you need to know. That mostly is done, which is called the master gland. That's something that usually comes in exams. Because they need to know the big picture. They want you to know the big picture. Now, this pituitary gland has two lobes, two little structures right there. See, you have one right here, separated. You have this one right here, and you have this one right here. So be careful that when you see this, you're not gonna see this. So it looks like the testicles, but they are not testicles. That's the pituitary gland. So you have an anterior part, an anterior lobe, and a posterior lobe. See? An anterior lobe and a posterior lobe. And this is important. Why? Because the anterior lobe produces hormones. See, the anterior lobe produces hormones. Whereas the posterior lobe do not produce, stores hormones that are produced by the hypothalamus. See, I told you that it was going to be a little complex. So this is the posterior part. So this posterior part, see the hypothalamus right here? This is another gland. This gland produces two hormones, and after it's being produced, it's sent it here, and when it's needed, it's going to be released. So the posterior does not produce anything, stores, but the anterior part does produce several hormones. We're going to see them later on. So that's basically how it works. Any questions about the pituitary gland? Remember, what I want you to remember is the pituitary gland is known as the master gland. It is located within the brain. Remember, the brain that controls everything is the brain, nothing else. So anything else usually is not questioned, but if sometimes they want you to know the two parts or the two lobes of the pituitary gland, one is anterior, the one is posterior, but the key here is that the posterior does not produce anything, stores. The anterior part produces. So we're going to see which hormones are produced by the anterior part, which hormones are released by the anterior part of the pituitary gland. Remember, one produces and releases, the other one don't produce, they just store it and then release it. Next. So these are the hormones produced by the anterior pituitary gland. You can see it by the title, anterior pituitary hormones. Here we have the growth hormone, or GH. Remember, in medicine, we use lots of acronyms. This is not an abbreviation. Remember, acronyms is when we take the first letter of each word and we kind of simplify the term. G for growth, H for hormone. So the GH, the growth hormone. So as I mentioned before, what is the major function of the growth hormone? It says right here, it stimulates cells to enlarge and divide. Remember, mitosis, if it is within the regular cells. Meiosis, if it is within the growth and development of the sex cells. That's a different issue. Because remember, the cells of our body are continuously dividing because they are continuously renewing. Have new cells every single time. The cells of our body, they do not just stay there forever from day one. The cells that I was born with, I don't have any because they are continuously being replaced. Some of the cells that I do have, you have, that they do not regenerate, meaning you don't have new ones, are the brain cells. So whatever we have in the brain cells we were born with, and that's it. After growing and developing completely, those are the cells that we're going to keep forever. And that is the reason why we develop dementia or Alzheimer's. And at late age. Not gonna get into that. Just know what is the growth hormone. Remember, this growth, that's what it says growth, because it helps them to develop, to grow, to multiply. This is the first one. So we're not following a specific order. That's it, growth hormone. Then we have prolactin. We mentioned this before. Lactin means milk. So it promotes milk formation, production when the female becomes pregnant. So the body already is preparing. See how smart our body is? It prepares before, so it has all the tools to deal with all these unforeseen situations. That's how it is. Number 3, the thyroid gland. So the thyroid gland produces 2 hormones, T3 and T4. This is called, we call it T4 and T3 and T4 because it's a lot easier for us to pronounce it. Otherwise, we have to say thyroxine or tridothyroxine or tyronine. That's a kind of very difficult name. When I evaluate my patients for levels of the thyroid gland hormones, I'm not going to talk about thyroxine and, well, I know what it means. And tridothyronine, no, that's too long. It's how's the T4, how's the 3T, the T3. That's basically how we go about. This is a lot easier. Remember, it's like instead of saying growth hormone, I said, oh, GH, that's it. Very simple. These hormones assist our body with metabolism. These are the ones that controls whether we gain weight or we lose weight. These glands are very important in our body. So they have to be evaluated continuously. Number 4, we have the adrenal glands. Now, these adrenal glands are the little glands that are above the kidneys, remember. So what is it that they produce? Well, they produce lots of stuff, lots of hormones. They have something that is called cortisol, glucocorticoids. They produce also adrenaline. You heard about adrenaline. Comes from adrenal glands. Non-adrenaline. So we're not going to go into that because those are not actually questions that you will be asked. But these are the ones, cortisol and glucocorticoid and all those things. Because it says right there, it is produced within the adrenal cortex. Because the adrenal gland has 2 layers. The outer, the adrenal cortex, the inner, the medulla. So each side produces certain hormones. So that's basically what it is. Then we have number 5. Gonadotropin hormones. Remember gonads? We talk about gonads. What are the gonads? The male and female's essential organs. Testes, ovaries. So these are hormones that are going to be targeting the testicles and the ovaries. These hormones are called the FSH and the LH because it's a lot easier. Instead of saying follicle stimulating hormone, FSH, It's a lot easier. Or the luteinizing hormone, LH. These are names are a little difficult. So we're just gonna check the FSH and the LH in the males and the females, because these are the hormones that assist the ovaries and the testicles to produce testosterone, progesterone, estrogen. So that's basically what it is. So with the assistance of these hormones, now the male and the female can produce the sperm, can produce the eggs, can produce testosterone, can produce estrogen. So that's how it works. So remember, these glands producing some hormones, but these hormones are going to be sent to a target organ. So that target organ can accomplish its functions. So this is kind of, a little basics of these particularly hormones that are produced by the anterior pituitary gland. Remember, they are produced there. Now, what happened to this? The posterior part. We're going to talk about the posterior part. Oh, let's talk about clinical implications or applications. So conditions that results when there are too much of too little of these particular hormones, particularly the growth hormone, the GH hormone. So you heard about, pretty sure, dwarfism. Not dwarfism, you heard about dwarfs. You probably watched the movie The Snow something. So it has these dwarfs, these little people. Those are dwarfism. So what causes dwarfism? Deficiency of the growth hormone. So when you are growing, even including inside the uterus, the womb of the mother, as the baby is developing, she's still a fetus. Remember, the baby, when it's inside, it's not called a baby, it's a fetus. When it comes out the womb of the uterus that is being delivered, now it's called a baby. So if you don't have enough growth hormone as the fetus is growing and developing and is being delivered and then doesn't receive this hormone, the child is going to become a dwarf. And it's also called enanism, because it's a little people. That's what some people knows them as. Deficiency. So think about the opposite. If you have too much growth hormone, what's going to happen? Giantism. Oversecretion. See, here is a deficiency of growth hormone. Here it is oversecretion of the growth hormone. But pay attention during childhood, because we are going to have another one that is called acromegaly. It cannot be mixed up, confused with giantism. See, giantism is someone who in its growing years, so between birth and 18 years old, grows, and all the features of its body his or her body are normal. They just tall more than the average. Giantism is someone who is 6'4" or 6'5", 6'7", 7 feet tall. But then when it reaches the age of 18, they stop growing. That's it. They no longer grow. But if you look at them, the only difference in between them and us is that they are taller, very tall. They are giants. Now, let's talk about acromegaly. For those who took anatomy or took medical terminology, sound like a broken record, but I just want to make sure that we did cover this, and that's what's important to take medical terminology. So megaly means enlargement, excessively large. Acro means extremities. So this is an enlargement of the extremities. So now, what is exactly acromegaly? Well, acromegaly happens when the person has an oversecretion of growth hormone. But be careful, because this excess or oversecretion of growth hormone happens during adulthood, not childhood as giantism. So this person was supposed to stop growing when they reach maximum of 18 years of age. But they keep on secreting, these glands keep secreting and secreting more growth hormone. So what's gonna happen to this person's body? It's gonna have a deformity. They are physically different. They're gonna have the arms, the fingers, the hands super large, the head super big, the forehead super large, the nose very big, the ears very big, the chin very big, the cheeks very pronounced, the legs and the feet very big, like a monster. Let me give you an example. Have you seen oh, how can I forget this? Oh, this I have it already. This is just slip on my brain. The Addams family. You see the monster there? That guy who plays the role that has acromegaly because it's deformed. This person I encountered, whether it's daytime or nighttime, I'm gonna be running like I never ran before. It's scary. Whereas if you find someone who is very tall, but it's normal, you're not worried about that. It's just tall. See, that is the difference. So everything is kind of out of proportion. So these people, of course, they're gonna have problems. Can you imagine they're gonna have a large and thick tongue, very large nose, hands, feet, the jaw, heart, the thyroid, all the organs are gonna be out of proportion. They're gonna be enlarged. So see the difference? So the growth hormone, very important. Because that's the one that can cause someone to be very, I mean, what is a dwarf? What's considered a dwarf? Dwarf is someone who is shorter than 3 feet. So yeah, sometimes because we are short, particularly me, I'm short, people can say, oh, you're a dwarf. It doesn't matter, it doesn't bother me. I'm just short, but I'm not a dwarf. That's a different thing. It is very, very short, but it's a form of, people just trying to get on your skin, but no consequences. So that's basically what it is. So now you know the difference between a dwarf and a giant and someone who suffers from acromegaly. Totally different. Oh, Frankenstein. That's the one that I was trying to bring to my mind. Then I was like, okay, the Adams family. I didn't know who it was. I had too much stuff in my brain, and sometimes, when I retrieve them, they come out. Sometimes it's just, well, I'm not the type of person who is talking about this all the time. So, but that's exactly what it is. So now you have an idea. Someone very tall in normal features, and someone very tall but deformed. So that's how you should be interpreting this. Any questions about growth hormone um, conditions? That's how it is. So let's talk about the posterior pituitary hormone. So we're going to make it kind of simple. Remember that the posterior lobe of the pituitary gland does not produce hormones. It's just a storage room because it is produced within the hypothalamus. Once again, this is another gland that is located right underneath the thalamus. Well, you don't know these glands, but you have a little gland right here within the brain, right here in this area. So you have one gland right here, then you have one right here. So right below the thalamus is the hypo, because hypo means under. And then you have the pituitary gland. And the pituitary gland is the one that we are talking about right here. That we have this posterior and this anterior part. So we talk about the anterior part because the anterior part does produce all these hormones that we mentioned before, but the posterior doesn't. It is produced right here. So which hormones are produced within the posterior, are released within the posterior part? The ADH, very important hormone. I mean, for now. This is called the antidiuretic hormone. You probably heard about patients who are taking diuretics. Well, diuretic medication is something that you use to release excess of fluids. In other words, make you pee more often because you have fluid retention inside your body. So then we give you a diuretic because we're going to remove that. Otherwise, you're going to kind of balloon, like fill all with fluids inside. So we need to remove that. Now, this hormone is anti-diuretic. So this is the hormone that retains fluids when we drink and release them when it's needed. So when you drink water, these hormones are going to drink that and it's going to keep it. And it's going to distribute these fluids into the blood system. So that's why the blood has 92% water. Remember, when we drink the water don't go directly to the blood flow. That doesn't work that way. Remember, it goes through your mouth, through the pharynx, through the esophagus, through the stomach, small intestine, right there. Water, it is absorbed. And then it passes to the blood. and the blood passes through the kidneys. And the kidneys remove blood that is in excess. Too much water, you pee it out. So the anti, because anti means against, diuretic, against releasing, letting go water, fluids. So we have hormones that retains our fluids. That's why we survive when we don't take water for quite some time. So that's basically what it is. Now, another hormone that is produced there is called oxytocin. Now, you as a female, if you have babies, probably you know this. Because oxytocin is this hormone that is released during childbirth. Why? Because this is the one that makes your uterus to contract so it can push the fetus out. And when that's not happening, so if you're not having the posterior part of the pituitary to release oxytocin, this hormone that contracts your muscles, the uterus, so you can push your baby out, now you're not going to be able to deliver your baby vaginally, normally. Now there are two options. Or we do the epidural and we inject you pitocin, which is the synthetic version of oxytocin, so you can deliver your baby, or we can do the C-section. So you see how important all these hormones are? Because they have a very, very important function in our body. Very important. So don't worry, I know that it's almost time for break. So I'm wrapping this up because I don't want to leave it, incomplete because I don't want to go start and middle and one needs to have the whole feeling of this. So not only oxytocin help you with the contraction of the muscles of the uterus to get the baby out, but it also assists the mammary glands for the production of milk. Not the production, the ejection, because we have the females have the mammary glands, but the milk is right there in these glands. So how that milk is going to go through the nipple, through the baby, when they start kind of suctioning into that nipple? Because these muscles, this oxytocin, go to the breast and contract the muscles from the inside out and pushes the milk up through the nipple. That's how it works. That's how it works. Very interesting, right? So now you understand that there are two hormones that are not produced, are released. ADH and oxytocin. And this sometimes can, show on a exam. So which of the following hormones are produced on the posterior? They might say that are produced, don't argue. There's nobody to argue but with scream, right? So it said produce. Oh, they all the time make the mistake. Produce. No worries. Look for ADH or oxytocin. Usually it's ADH. And they phrase it this way. ADH, hormone ADH, or the antidiuretic hormone, is produced in which lobe of the pituitary gland? Posterior. It doesn't matter if they produce, because usually these people always use that term, this misuse. It's not produced, it is stored and then released. So ADH usually will be the case. So think about that. So ADH always related with the pituitary gland. But they don't want to know just the pituitary gland, the posterior lobe of the pituitary gland. Okay. Any questions before we go into a break? Okay, so let's go on a break. It is 7:05. We'll come back 7:35. Okay, so moving on. Everybody, 7:35 it is.
Okay.
Okay. See you guys later. Enjoy your break.
You too.
Okay.
Thank you.
You're welcome. Mhm. Okay, so we are back.
Hey.
Okay, so let's put this chapter back again. Time goes super fast. I was trying to get something done and no. Couldn't do it much. Anyways. Okay. So we were talking about these two hormones that are secreted, stored within the posterior pituitary gland. So do not forget this. ADH, antidiuretic hormone. They're not going to ask you the function. They're not going to ask you anything deep. They ask you is simple, straightforward questions about where is this hormone released, or if they said, which of the following, as soon as you see posterior pituitary gland, ADH will be the answer. So it doesn't matter whether it reads, produce, release, whatever, they don't even know what's going on. They just select that it is the ADH. That's basically what it is. Let's talk about now the thyroid gland. Now, once again, for this one, we're not going to go too in details because we're not going to talk about metabolism in details, very complex, so we don't want that. So, once again, remember this gland, usually in questions, they're going to ask you, this is located not within the pharynx, not within the larynx, none of those things. Usually they said it is located in front of the anterior part of the neck, within the chest, above the adrenal glands of the kidneys. So that's what they're gonna ask. They're not gonna ask particularly, the exact position now or location. It's just for you to have an idea that you know what gland they're talking about. Because remember, these courses are not too detailed, too intense. So just the fact that you know where it's located and probably the most common hormones that they produce, good enough. That is it. So once again, these hormones works with iodine. It works with iodine. This is like insulin working with sugar. This hormone works with iodine. So it needs iodine to do its work of metabolism, to send all these hormones to our body so our body can keep this homeostatic process. So it can keep our body balanced. That's how it is. So if you have problems with iodine, you're not consuming enough iodine, then what's going to happen to your thyroid gland? It's going to work hard. And if it works hard, you're going to develop a goiter. See, because it's located right here in the anterior part of the neck, you're going to see this bulging right there. That is called goiter. That goiter is a consequence of the thyroid gland working too hard to produce this thyroxine and thyroxine, or T4 and T3. So that's basically what it is. Remember, there are two conditions. One, if you have deficiency of iodine, or the thyroid hormone for that matter, because we don't measure directly the iodine at the moment, you just measure T4 and T3. So when we send for blood work, that's what we check, that these two hormones are being produced by the thyroid gland. If we have deficiency of the T4, because T4 is like more abundant, it's like the one that we actually reference to diagnose our patients with high levels of this hormone or low levels of the thyroid gland hormones is T4 most of the time. So once again, if you have too much of the thyroid hormone, then you're not going to develop goiter. You're going to develop another condition. So I mentioned this because we went over certain medical terms that we are going to be seeing later on. So for now, that is what I'm being just giving to you. So the hormones that are produced with the thyroid is T4 and T3. Once again, they're not going to ask you about thyroxine or tridothyroxine. So these numbers, what they mean is because why did I put T4 and T3? Simple. T4 means that this thyroid hormone contains 4 iodines. That is it. That's the answer. So you know the answer for T3. T3 stands for the thyroid hormone that contains 3 iodines. It says right here, 3 iothyronine. So that means 3. Well, it should be something here that says 4, right? But it doesn't. So it says thyroxine. That's it. So the 4 after the T means the number of iodines that this hormone carries. The 3 after the T means the number of iodines that this hormone carries. So that's basically what it is. Now, right here within the sites, we're going to find 2 pairs of the parathyroid glands. See? This one right here and this one right here. So this will be considered the parathyroid. They're going to be on the sides. We're going to see it probably next. But that's how this works. So we're not going to make it any complicated. It's already complicated. So this is how we're going to see. So here, usually they're not going to ask you about the T4, the T3, but they're going to ask you, where is the thyroid gland located? And probably keep in mind, what is its functions? To keep a homeostatic, just think about metabolism. Anytime that you hear about metabolism means all the chemical functions inside the cell. So that's what these hormones control. So that's basically what you need to know. The thyroid gland, simple. The adrenal glands. Now think about the adrenal glands because they are located, remember, above the kidneys. Look a little heart, like a little cone. So questions for this will be, once again, what are the name of those glands located above the kidneys? Usually I said on top of the kidneys, but they like to use above because it's more technical terms to use. So that's basically what you need to understand. Now, these kidneys contains 2 layers, 2 walls. The outer is called the cortex, and the inner is called, this part inside is called the medulla. So the outer is the cortex, and the inner is the medulla. Oh, what am I doing here? I'm doing the kidneys because I've been thinking about the kidneys, guys. So forgive me for that. So we have right here the part that I put on top that is, once again, the cortex, and whatever is inside is the medulla. So the cortex produces certain hormones, and the medulla produces other hormones. So that's how it works. So it says right here, remember that we mentioned already that the cortex produces cortisol, because cortisol, see, cortisol and corticosteroids, cortex. So that's how we relate them. Now, the middle part, the inner part, which is the medulla, it contains two hormones. Epinephrine, which is adrenaline, because it is more known. We know that a lot using this name adrenaline versus epinephrine. Probably some of you have heard, but if you didn't, no problem. So this is called adrenaline. And the other one is called norepinephrine or noradrenaline. So that's it. Now remember, these hormones are the ones that assist the sympathetic nervous system and the parasympathetic nervous system. So when we talk about the nervous system, we talk about the fight and flight response. So whenever we are like in a rush, whenever you feel like wanna be doing like these very risky things or sports or something like that, that you're kind of not afraid of taking a selfies right there in a cliff or on the top of a building and says, hey, I'm not fearful of anything. That is epinephrine, adrenaline. Or when you drive a car, faster than you're supposed to, and you think that you are a better driver than anyone else, that is adrenaline. When you challenge someone like for something and you argue and argue, is your adrenaline that goes on. Noradrenaline, well, that is just the opposite to it. Remember, one thing kind of excites you, the other one relaxes you. So that's basically what it is. Remember, we have this negative feedback. If something goes up, it must come down. So that's how we regulate all these processes of homeostasis. So basically, that's what it is with the adrenal glands. Now, are they going to be asking you something about the walls or no? Usually, it's just where those glands are located. So they are above the kidneys. We have two adrenal glands. So that's basically what it is. Any questions about the adrenal glands? Okay, so we go back to the pancreas because it's an endocrine gland, but also is an exocrine gland. So the pancreas is considered a dual gland. So if, once again, it is an endocrine, secretes substances within the body, and an exocrine, things outside the body of the organs. So that gland not sending the blood directly to the blood, but to other organs. That's called exocrine, or outside the body. That is exocrine. So endocrine secretes hormones into the blood system or blood fluids or the body fluids. So usually it's the bloodstream. Endocrine, remember. Exocrine secretes these hormones or these substances. It's not hormones. These are going to be the enzymes into another organ, not to the blood system. Any organ that produces hormones is called a gland. And whatever is being produced, Once again, that is a hormone, is going to go directly to the blood system. If it doesn't go directly to the blood system, it's not a gland, it's an organ. So the pancreas has both. It is an endocrine and an exocrine gland. So just keep that in mind. Two hormones that are secreted from the pancreas, we mentioned them already. Insulin and glucagon. Here is written, where are they produced? Yes, they are within the pancreas, but there are some little spaces, some little islets, so like a little islands, if you will. Inside the pancreas, we are going to encounter the alpha cells. And the alpha cell secretes glucagon. And what is exactly glucagon? Sugar. And the beta cells, they secrete insulin. So pay attention to this, because if they ask you where is insulin produced, you know already that is within the pancreas. Now, also they can ask you in which part of the pancreas is insulin secreted. So if I don't mention this to you, you're going to be saying like, what do you mean in which part of the pancreas? Oh, are they talking about the inferior part, the upper part, the middle part, the sides? No, they mean in these particular spots within the pancreas that are called islets, some small islands. That's basically what it is. So right there, alpha cells produces glucagon, beta cells producing insulin. That's basically what it is. So whenever we look at these particular hormones or cells, we're going to be trying to figure it out, where are they produced. So that's not our job. It's already discovered. So the only thing that we need to know is where are they produced. So if you have any questions, those will be the questions that you will be asked. Remember, insulin decreases blood glucose. It regulates the amount of glucose that runs within the blood. So if it is too much, try to bring it back to normal. Negative feedback. Now, what happens if it is too low? Oh, glucagon is produced. Now you don't have enough glucose for any reason. Your body's not absorbing, because some problems, structure problems within the body, or you're not consuming enough. So in these situations, which is kind of rare, then glucagon will be produced. Because remember, most of the times we eat a lot. And whatever we eat contains lots of carbs, lots of fats, lots of proteins. They come in large quantities. Vitamins, minerals, they are small quantities. And we don't need much. So basically, that's how it works. So usually glucagon is not asked, but keep it in mind. Remember, beta cells produces insulin, where? Within the pancreas. That's it. That's what you need to kind of keep in mind. Let's talk about these major conditions that are caused by excess of glucose. So I'm going to give you a little details, but then I'm going to tell you exactly the simple form that you will have your questions stated in an exam, because that's important. So we have the most common types of diabetes. There are two. I mean, there are three, there are four, there are more. But these are the most common. And then we talk about number three, because usually we talk about two types of diabetes, because the third one only occurs in certain situations, to certain genders, if you will. So let's discuss the first two. type 1 diabetes mellitus. Remember, you can say mellitus, it doesn't matter. So type 1. So what is the problem with type 1 diabetes? Usually we write down DM. Remember, DM, diabetes mellitus or mellitus. That's it. That's how we gonna encounter it everywhere. So you gotta be familiar with these terms and with these acronyms. Now, what really happens when someone develops type 1 diabetes? Very simple. This is someone who was born with that condition. The pancreas, the cells, the islets where this insulin is produced, it is damaged, it is destroyed, it's not working. So it's not producing insulin. So every time that you eat something, that insulin is accumulated in the blood system and it's not moved or removed from the blood system because you don't have the cells that do this work. Think about you are in the train station waiting for your train and your train does not arrive. But people that use the service, this public transportation, are going to pile up right there by the station, right? But there is no train. So you got an excess of people in the platform. Now you got an excess of glucose running in your blood system, but nothing is controlling it. Nothing is regulating it. Now it has to bring, see what insulin does, and it picks up all the blood, all the glucose from the blood and take it. It's like a train. Picks the glucose and enters each one of the cells and delivers this glucose to each cell. But it delivers only whatever the cell needs. It's like you place an order of something. So only those things that you order are going to come to your door, not more or less. Well, assuming, right, that they collect the right order. So that's basically what it is. So that's what insulin does. Insulin is not there like a traffic. Oh, well, you pass, you don't pass. No, no, no. That's like the train. And we, the people, are the insulin inside the train, the glucose. And it's going to be transported to each cell. So each cell is going to receive a little of glucose. And then whatever glucose stays within the blood, it has to be with certain normal ranges because we are going to pick up glucose again because the cells are continuously working, active, they need energy. So we are taking glucose from the blood, passing it through the cells and removing the wastes and so on and so forth. That's a cycle. So if your cells, the cells that produces insulin are not there, they are being destroyed because the area where they survive is not there, it's damaged. That's it. So this is type 1. So we are going to know that you have type 1 in a very early age of the patient's life when you are a little baby. So we know that. So we're going to find out that. Now, this diabetes type 1 usually is known with different names. Remember, it's called juvenile because it happens when you are young, or insulin dependent. Why do we call it insulin dependent? Because our body depends of insulin treatments to do the work, because think about this, we are not producing insulin. So now the treatment has to be given to you. So I have to give you insulin. So if you know someone who is diabetic and it has insulin, okay, well, that have changed. But most of the time, if it is a younger person and you see that they have diabetes, then if they are getting these insulin shots, well, then probably they have type 1. I'm going to explain that because back in the days, insulin was only given to these patients that did not have these cells that produces insulin. Makes sense. If I don't have insulin production inside my pancreas, what is it that the doctor is going to give me? Insulin shots. So it's going to give me insulin. So that insulin is going to make up for that insulin that my body is not producing. Period. So that's what is called insulin dependent. Remember, it's called also juvenile diabetes mellitus because it is discovered, it happens at early age because your cells, the cells inside the pancreas, the beta cells are not producing insulin. That's it. That's what it's called type 1. Now, if you see, it says right here, 5 to 10% of the cases as type 1. So it's not many cases because you are born with the defect. So that's basically what it is. So it said right here, because the cells are destroyed, lack of insulin production. So your body is not producing insulin. That's why I have to give you treatment from insulin. So you depend on insulin treatments. So that's type 1. Remember. So usually the question will be, okay, what is the problem with insulin? Oh, diabetes type 1. Oh, the pancreas is not producing insulin. That's it. Oh, the beta cells are destroyed. There's no beta cells, so there are very little beta cells. So not good. That's it. Now, type 2 diabetes, on the other hand, is a different one. This is called an acquired diabetes mellitus. Now it has different names, and pay attention to this. It is called maturity onset or non-insulin dependent. Now, let me tell you what is exactly diabetes type 2. This is a diabetes that happens to people because of the bad diet. They eating too much glucose, carbohydrates. They don't do exercise, they smoke, they drink, or all of the above. They do a little bit of something, but most importantly, it is the diet that they follow. So that's basically the other ones has nothing to do with diet. It's just that I was born with my pancreas that the cells are not producing insulin. So I have to give you insulin. There is no other way to treat insulin type 1 that is not with insulin. That's it. You're not producing it and giving you insulin. So now we're going to go to diabetes type 2 again, because we have to play down with those two to see what changes have happened. Because you probably know someone who developed diabetes later on in life when they were an adult, but then they are on insulin as well. Well, they taking medications, tablets, but at the same token, they are taking insulin. So we're going to talk about that a little bit so you can understand that if you have someone in the family or you heard about something like that. So this type 2 diabetes is called maturity onset, meaning it happens when you are an adult. Because remember, this juvenile or diabetes type 1 happens before 18 years old. It says right there at the age of 20, but usually happens earlier in life, very early. That's the latest that it can happen. Why? Because the person's pancreas have very little cells, but they are not enough as you grow up, not enough to keep you going, because you need to be producing continuously and you have very little beta cells, so not enough. So it comes to the time that you're not able to do certain things. You go to the doctor diagnoses you. But that's not the point right now. You were born with a damaged pancreas or damaged beta cells, period. That's it. Now, type 2, because it's called maturity onset diabetes or non-insulin dependent. Remember, it says non-insulin dependent, doesn't need insulin. But things have changed, and I'm going to tell you why in a little bit, so you can understand why people who are diabetes type 2 are taking tablets for diabetes, but at the same time, insulin is being added to their treatment, because this is happening not long ago. So we will discuss that in a little bit, because it's important that you understand, because you're going to have these patients coming to your office, because you have tons of patients with diabetes, particularly diabetes mellitus 2. Look what it says right here. 90 to 95% of cases are type 2. I'm not lying. Many people have diabetes in this country, because we are living here, so we're talking about this country. Too many people, and day after day, we have more and more and more. This is a diet problem. Remember, it's the things that we eat and the things that we don't do. Because if you eat a lot of stuff, we should do lots of exercise to burn all these calories, to utilize all this extra glucose, which is energy. It says right here, insulin is produced. So we have enough insulin. It's just that the body cells are unable to recognize that, because we have too much. It's not that they are able to recognize it. It's that there are too much sugar. Think about the train. Think about all these people in the train station. You have so many people in the train station that not all of them are able to go inside the train. They have to wait for the next one. And what about if there is no next one right there? You're going to be late for work, for school, whatever you're going to do. So that's what's happening right here. You put too much sugar, then there's so much sugar within the blood system that you don't have enough insulin to carry all this sugar to the cells and put the other ones aside. So excess of glucose is going to remain in the blood flow. So that's what it is. That's what type 2 is a problem now. Because it's not someone who were born with damaged pancreas or damaged cells. It is diet. It is the things that we eat. So that's basically what it is. Now, remember it says non-insulin dependent, but you're going to encounter some patients that are taking insulin and they're going to come to your office and they're going to say, oh, I'm here to see a doctor. Okay, may I ask what is the reason? Say, yeah, I want my insulin. Oh, I want my syringes. Oh, I want this. Oh, I want a prescription for this. And you're going to say, oh, wait a minute, this person needs insulin. This patient has diabetes type 1. Wrong. It's not. Diabetics, the type 1, you're not going to encounter them much. They are very, see, it's 5% of our entire population, which means almost nothing. Compared to diabetes type 2, that is 90 to 95%. It is almost the entire population of diabetics that are type 2. So this is the thing. We are treating patients with diabetes type 2, right? We give them the tablets, and the tablets by itself don't do the work, so we give them a plan. We give them a list of things that they should do to keep this glucose at bay. So these are the recommendations. Okay, we're gonna give you these tablets. We're gonna give you this many milligrams according to their age and the amount of insulin, the amount of glucose that they have over consistently. Remember, we don't give the same dosage to every one of the medication. It all depends who's the person, how much they weigh, what's the age, what are the medications they're taking, what are the conditions they have. So then we tell the patient, okay, here are the tablets, you're going to take this medication, and now these are the things that you're going to be doing. You're going to stop eating this. We're going to put you on a diet. Doesn't sound good, right? We're going to tell you what to eat, and that's something that you don't like, because you don't like to be told what to do. Then we're going to ask you, you got to do regular exercise, okay? You can't just be sitting at home. Good. Some people don't like to do because it's winter time, it's too cold outside, whatever, just a joke. They just don't do exercise enough. Number 3, if you're a smoker, you have to stop smoking, okay? If you are a drinker, you have to stop drinking alcohol. For some people, that's a little harsh. So what happened that I give you the medications, you don't follow my instructions, you don't stop doing all the things that I told you not to do or to do, like do exercise, change your diet. I'm going to refer you to a nutritionist so they tell you exactly what you're supposed to be eating, not just what you're supposed to be eating and the amounts of food that you should be eating from that selected variety of things that you should be eating. You're not stopping smoking, you're not stopping drinking. Now, what's happening to your blood glucose? It's going to continue the same. It's not going to change. So because it's not going to change, now different things have been done. So the CDC, the FDA, particularly the CDC, which is the Centers for Control Disease, have decided we're going to do a little changes. We are going to add on top of the medications, the pills, the tablets, whatever you're taking for diabetes, we're going to add insulin. So now we are adding another medication to you and see if that can help you because you're not doing the right thing. So now we have to add more stuff so you can kind of, level a little bit the excess of glucose that you have. So that's diabetes type 2. You see what is the big difference between type 1 and type 2? This diabetes is also known as an acquired diabetes because it's not something that we were born with damage of the pancreas. It is something that we acquire because of our diet, the things that we eat, the food that we eat. Okay, so now you know the difference between those two. I don't think so you're gonna forget this, not for a while. Now, these are the two most important diabetes. Why? Because one, you were born with, and there is nothing we can do, but we have to treat it, right? There's no other treatments. We cannot give you a new pancreas for that. The type 2, well, we discussed that is an acquired diabetes. You're eating too much carbs and fats. So now you have too much glucose inside your blood. Even though if you are producing enough insulin, it's not enough to carry and to regulate all the excess of insulin. So that's basically what it is. Think about you working in a factory and you are the only one doing everything. That's impossible that you're gonna finish. You're gonna do one thing, two things, and a little bit, but everything is gonna be unfinished. So the same, because it's too much overload for you. Let's move to number 3, diabetes. It's called gestational diabetes. Now, this is very particular because this only happens to certain females during pregnancy. That's what it's called, gestational diabetes. So it's not the whole population. It's not the husband, it's not the children, it's the mother, the women who are impregnated. Only to them. Now, you got to understand this. This diabetes happens only to the people who are, okay, let's rephrase this so I don't get you confused. So let's say that an example, a female Mrs. A becomes pregnant, but he's already diabetic. Is she gonna develop gestational diabetes? No, she's already diabetic. So for someone to develop gestational diabetes, they should not be diagnosed already with diabetes. It makes no sense. I already have diabetes, so what other diabetes I'm gonna develop? It's the same one because now you become pregnant. It's not like this diabetes is gonna disappear and you're gonna get another one. It doesn't work that way. So gestational diabetes happens only to females who have never been diabetic before. So when you become pregnant, you develop diabetes. How? Why do you develop diabetes during pregnancy and you never have diabetes before? Well, because you have all these hormonal changes. And some of these hormones, they regulate insulin. They regulate other things. So that's basically what it is. Now, besides that, during pregnancy, you eat more frequently and more volumes. Why? Because you have a second life there that you have to provide with nutrients. So usually females becomes like they want to eat more. That's normal. You're going to put on some weight during pregnancy. It happens to 99, let's put it 99% of people. But then after pregnancy, they lose that weight. But some of the people develop diabetes during that period, during that stage of pregnancy. Now remember, one condition is you should not have diabetes prior to the pregnancy in order for us to call you that you have gestational diabetes. So that's something that you need to take in consideration. Now, there are little things here and there with diabetes. Someone who developed diabetes during pregnancy, they are prone to develop diabetes in the second pregnancy, third pregnancy, and so on and so forth. So they are predisposed to develop diabetes the next time because you already have it. Now, another thing, after the pregnancy, some females become diabetic. Some. So now you have diabetes type 2. It's not that you're going to continue with gestational diabetes. No. Gestational diabetes ends when you give birth. Then, if you continue with diabetes, then it's going to be type 2. That's it. It becomes type 2. So you're going to have diabetes, probably for the rest of your life. Now, not always someone who develops diabetes, gestational diabetes, they become diabetic. That's not the case. That's not what I'm saying. Some of the people might go into diabetes type 2 and they become type 2. But it is true that after you develop gestational diabetes in your first pregnancy, now you deliver the baby, diabetes goes away, you become pregnant again, you can develop gestational diabetes. And if you become pregnant again, and after that, you can become diabetic at any stage of these pregnancies. You can become a diabetic type 2 or not. So these are two kind of things that can happen. So we have to consider that. Diabetes is a problem during pregnancy because you're going to have problems with pregnancy. If your baby, remember, if you are diabetic, then your baby is going to be gaining a lot of weight, your fetus. And then you're going to have problems delivering the baby, so you have to go through C-section because the baby is too big, too heavy. That means it weighs more than 8 pounds. Yeah. Probably some of you are saying right now, oh, I gave birth and my child was 20 pounds. No, we're just kidding. 9 pounds, thing like that. Well, there are different situations, remember. But most of the cases, particularly for primiparous, which means someone who's having a baby for the first time, because these channels still narrow, they haven't stretched because you haven't had births before, you're gonna have tough time trying to deliver the baby. So we do C-section. There is no such a thing as doing epidural, giving you pitocin or anything. No, C-section. There is no question. Particularly if you have gestational diabetes, because your baby can die during the process because it's not gonna be able to come out through these childbirth canals. So we do C-section. And remember, you put in a risk the baby because the baby can become diabetic later on because it has too much sugar, because it's the sugar of the mother that passes to the baby. Not always, but can become diabetic because it's predisposed to it. So there are lots of things now. Not only that you are going to have a big baby and you might have problems delivering the baby, but also you develop something that is called preeclampsia, and even worse, eclampsia. So all those things are part of these gestational diabetes. Remember preeclampsia, probably you heard about it. Maybe you heard about some family member, friends, something like that, that developed hypertension when you were pregnant. Well, that is part of gestational diabetes as well. It can happen without, but you are more at the risk when you have gestational diabetes. So then developing hypertension when you are pregnant, that's not good at all, because we have to keep you in control all the time. You are a risk. You have a risk pregnancy. So that's basically what gestational diabetes or all the see the difference between all of them. So it's important to understand what is the difference, not just memorize. Oh, type 1, somebody was born with it. Type 2, somebody that is the diet. Oh, they eating too much. That's it. No, not only that, there are other factors like, smoking, not doing exercise, alcohol consumption. In gestational diabetes, once again, you need to be pregnant. Well, only happens to females. Only happens when they are pregnant. Not to all of them, to some of them. There are people that are more at risk than others, because not every single female develops gestational diabetes. No, they are predisposed to some other things. So once again, very important, but most of the time is due to hormonal changes. Remember, that blocks insulin, that blocks other processes within the body, because it's a different change. You are going through different changes, and that can cause all these conditions to happen. Okay. Any questions about these types of diabetes or any of these type of endocrine glands or hormones? Remember, we talk about the hormones during the reproductive, male-female reproductive system for the ovaries and for the testicles, right? But we talk about the gonadotropin hormones. Remember the luteinizing hormone and the FSH. I was like FSHE. which is the follicular stimulating hormone. So they are the ones that, triggers the testicles and the ovaries to produce testosterone in males, and in females, progesterone and estrogen. But also helps with, once again, with the secondary sexual characteristics of males and females that we discussed this within the males and females reproductive system. So that's basically how I want you to see it. Any questions? Because these diabetes questions are very common in exam. Because why is common? Because there's a very common condition. Remember, you study something that is very common, something that happens very often, but you're not familiar with those things. And that's why I'm here to tell you. What is the most common conditions that the patient goes to the medical doctor? Because you're going to be a medical assistant, you need to know as soon as they come in and said, oh, I know, look at this. Oh, this teacher kind of knew something because, oh, these patients are coming here for this, for this, for this. And you're going to be familiarized with these terms. Remember, you're not there to diagnose, you're not there to give advice, to prescribe, none of those. But you feel so good when you know what is kind of going on there. This is like when you go to an unknown place, you go vacation for the first time. You have to have guidance, have to have someone who walk you through. It's not like when you are in your own area that you go wherever you go. You don't need to ask anyone, hey, what is this? What is that? No, you just go. But you're familiar with the area. The same is here. When you're not familiar, it's going to be a little difficult. It's a little challenging. It's a little overwhelming sometimes. So medical assistant is not just there than, receiving orders all the time. Do this, do this, do this. But knowing why you're doing it and why sometimes things are not going right, and you should know, oh, doesn't look kind of normal, kind of not right. So I'm going to do it again. That's what we go through all these classes. Okay, so if you have no questions for this, let's move to the next chapter. It is 828. We're just gonna do an introduction for the next chapter because that we're gonna cover it tomorrow. So the last chapter is gonna be the urinary system. So let's see, what is my urinary system right here? Digestive, oh no, I don't even have it right here. So let's go right here.
Does anybody hear something? Because I don't hear nothing.
This laptop probably died again.
Hello. I don't have to explain you again what happened. You know already what happened. I always forget this battery. Oh my goodness. It's driving me nuts right now. So my apology to you guys. You guys back? I mean, you guys there?
Yeah, it's okay.
Okay, can you
Yes,
see?
yes.
You know already how it happens to me all the time. Oh my God, try to correct this. I'm telling you that I have the system set up that whenever the battery is running low, a little pop-up window tells me, your battery is running off. So I plug my computer because you're not supposed to have your computer plugged all the time because you burn the battery. But I get caught up teaching and all these things, and I completely forget about this battery. By no means I remember. You see that it's been happening. It's not that I have a bad memory, no. It's that I focus on what I'm doing. So nothing else distracts me. Oh, I'm too much with these classes. Okay, guys, so we're gonna move now to the urinary system. So we're just gonna touch bases on this, give a little overview, maybe go over the major structures um, of the urinary system, and tomorrow definitely we're gonna be completing this chapter. So as the word implies, it says urinary. So urinary means pertaining to urine. So this is the system that deals with the production of urine. So we're going to talk about all these structures that are in charge of removing excesses of fluid from the blood system and then removing it as a way of waste of urine. Can you imagine we have something in our body that removes this excess of fluids? That's not bad at all. So when we get to this point of conditions that we develop with the urinary system, we're going to talk about, when we drink too much water. Is it good? Is it bad? What is enough water that we should drink? So we have to take in consideration lots of things when we do that. But for now, every single thing that we eat, most of the time, if we eat something solid, we need to pass something liquid. But sometimes we eat more solids than liquids. So we have to add liquids because these fluids increases the amount of blood in our system. But then when we have too much of fluids, the body has organs that are in charge of removing the excess of fluids. And the urinary system is one of them. So that's basically how it works. So urinary, remember urine means urine, and ARY means pertaining to urine. So pertaining to the system that produces urine, removes excess of liquids. It's not it's going to remove our liquids that we need, our fluids. No, it's going to remove those fluids that we have in excess, because we are going to keep our body homeostasis, balance. Remember, we have all these organs that regulates the amount of things. So if they are not working properly, then we have to do something, fix the organ so it can produce what's supposed to be producing, or the function that they are supposed to be conducting, or we want to add external therapy, which is medicine, surgical procedures. That is how it works. So the urinary system, I mentioned it already because this is so important for us to understand. A major part of the homeostasis process, which is maintaining the normal volumes of fluids within our body, within our organs, tissues, cells, everything. So that's basically what it is. So the urine removes not only this excess of fluids, but whatever is in excess that is mixed with. So that's what we have to be very careful. What is it that we eat? What is it that we ingest thinking that is good for us when actually probably not so? So sometimes we eat stuff that we think that is good for us, but actually it's not. Like when you have these multivitamins. Ah, professor, you're saying the multivitamins are not good. No, I did not say that. I said that you only should take the vitamins that your medical doctor told you are deficient of. If you have deficiencies of these particular vitamins, then you should take it. If you have deficiency of these particular proteins, well, then you should take it. But your doctor needs to do an evaluation prior, because otherwise you're going to damage your organs, putting all these chemicals over there that are not needed and putting the body to work when there is no need to work. You're giving extra work to your body that is not needed. See all the things that we do without not knowing? So that's what is important. And these classes are important because of that. Once again, I can give you these chapters and you can read it. Now, can you understand it? Can you actually get all this information? No, somebody has to explain it to you, not just to read it. I can read this, you can read it. That's not the issue. The issue is that you can understand what is written in these presentations. That is the purpose of the class, not anything else. Because if I'm going to put you to read and then I give you an exam, this is not the way it goes. So that's basically what it is. So whatever we have in excess and it is mixed with these fluids inside our body, it's going to be removed. So if you take vitamins, minerals, water in excess, it's not going to be stored in our body. No, there is no place in our body when you're going to have proteins, minerals, vitamins storage, water storage. No, there's no place. So if you take this in excess, your body needs to remove that. Think about your home. You don't sleep, you don't do anything, but you're exposed to all these. Well, if you let it pile up, it's gonna be harder. But if you, every day you clean, and you only bring what you need, not to have too many things that you have to move around, so you can sweep, you can vacuum, you can mop, whatever you do. It's gonna be easy when you don't have too many things at home, because if you see too many things to move, oh, you immediately change your mind. Oh no, no, I'm not gonna do it. I have to move that. Oh no. And I'm not gonna be moving every day, so I'm gonna be doing it once in a blue moon. So now you have to work harder. You see how hard you're gonna be working just to do something? If there's no need, you don't need to take it. But you don't know that. Who knows that? Your doctor. That's why you have to visit your doctor. I feel like kind of tired. I feel like kind of lazy. I feel like kind of this or that. I'm not able to sleep. Oh, I'm gonna see the doctor. And they're gonna ask me a bunch of questions and I'm gonna tell them what's going on. And then the doctor is gonna send some exams. That's why we have to be truthful to our doctor. We have to tell them the truth. What's really going on? We shouldn't be embarrassed of anything at all, because it's our body, it's our life. So if you tell me the truth, exactly what you're feeling and all that stuff, I can put it together and try to get a diagnosis and help you better. And that's what we're going to do with our patients, collect information from them and try to get as much as possible from them, more information, but that's the doctor's job. But we are the patients, aren't we? So we need to know what is it that the doctors goes through all these, and now to try to help us out, to try to treat these conditions. So sometimes we do things that causes us, our body, to fail because we just think that it's good. See all these commercials on TV offering all these multivitamins and all these water, vitamin water and all that nonsense. Well, we just believe everything that is advertised, and we just think that, oh yeah, females should take these, males at this age should take that. Seriously? No, I have to go to my doctor, and my doctor is going to tell me, because otherwise I'm going to put my organs to work harder for something that was not needed. And it's going to make me sicker. Think about it. You're putting something from the outside, something that is not needed, chemicals inside your body, plus whatever else is mixed with those chemicals, because those pills, those tablets, those powders, those drinks, is not only what they said it is in there. There are more. They put all these preservatives. These are chemicals harmful to our body. So we're not thinking about that. We're just taking something because we heard it does the body good. And that's what we need. Or what your friend or your neighbor recommended. No, that's not how it works. Your doctor needs to be evaluated by your doctor. And if I have any deficiency, they will tell me, what do I need? Let's talk about these structures that makes up the urinary system. Now, the urinary system is not that complicated. Well, let's rewind. Has a part that is complicated, but most of the parts that we're going to have are like the digestive system, just passageways, just structures that allow something to pass through, like pipes, like tubes. So basically, that's what it is. For instance, we talk about the kidneys. Now, the kidneys are a very complex organ, particularly when we go inside the kidneys and break the kidneys down, do a sagittal cut and look at all these microscopic structures. That's a different issue. So the kidneys are the major organs. We have two, one on the right, one on the left, two kidneys. Then we're gonna have two ureters. Remember, the ureters are these little tubes that are connected to each one of these kidneys that drains the urine from the kidneys to the urinary bladder, which is a reservoir, which is a storage room. We're going to discuss this in more detail because we're going to talk about the kidneys, the ureters, the urinary bladder, and the urethra. Now, if you see these three last structures, they are kind of simple because this is just a tube. These are tubes. This is just a reservoir, a little sac right there that stores urine. Stores, doesn't do anything else, just stores urine. It's like a garage. You just put things in there, but they don't do anything else. The urethra, another tube because this drains urine from the urinary bladder to the outside. So that's basically these structures. Once again, the more complex part is going to be the kidneys, because this is where actually the filtration of blood and the removal of the wastes, including excess of fluids, chemicals, vitamins, minerals, whatever is in excess, we're going to remove it. But that happens inside the kidneys. Anything else is just a pathway for the urine to leave the body. That's basically what it is. Very similar to the stomach. That it is like the center where digestion happens mostly. Everything else is like passage, pathways. So those are the things that we have to kind of consider every single time that we study something. What is the most complicated part? So the uterus, or the ureters, oh, we know that, these little tubes. So we're going to see the picture or image or drawing, whatever you want to call. So these are all the organs that we have here. So we're going to make it larger so you can see it better right here. So we have the two kidneys right here, right and left side. Here, the kidneys. Here we have the ureters. See the tubes that drains the urine from the kidneys to the urinary bladder, which is here. And then we have a little tube that drains the urine from the urinary bladder to the outside. It looks very simple, right? The trajectory of all these urine. But the urine formation is going to happen here, which is, once again, the complex part of the process. And then we're going to have just these tubes draining to this reservoir and then to the outside. That's it. So we're going to spend more time talking about these kidneys, these structures inside the kidneys, where filtration, reabsorption, secretion takes place. Very similar to the digestive system. Remember, we are talking about here filtration. That's a totally different process, and it happens within the kidneys. Then we're going to have reabsorption. Is not absorption. And I will discuss what is the difference between absorption and reabsorption. So think about you taking a test. That is called absorption. Now you failed the test. I'll give you the test again. That is retaking a test. That is reabsorption. It's doing it one more time or three or the third time around. See, that's how you are going to understand what reabsorption happens. But I'm going to tell you what is reabsorption of urine or reabsorption of certain products, certain components of urine. How did they happen? Where is this reabsorption happens? Where is filtration happens? Not just the kidney. We're not going to say, oh, the kidneys. No, no, no. It's going to be some structures, some particular structures within the kidneys that are going to be doing just the filtration, just the reabsorption, and other ones, just the excretion. Remember, we have secretion and excretion. So excretion, as the word implies, X means out, out. This organ out the body. So we're going to remove the urine from the kidneys outside, X, out. Secretion, on the other hand, means this particular secretions or these particular fluids of excess or waste are not going to be removed from this urinary tract. Is within the urinary tract that we're pulling things in and out from this system, not leaving the system. Not yet, until they reach this part where they're going to be secreted. So remember, secretion is inside, excretion is removing it outside the organ. Secretion is inside the organ. Everything happens right there. But it looks like it was excretion, but it's not because it's inside. In order to be called secretion, it needs to be removed from the organ, removed from the system, but it's not removing it from the system. It stays within the system. So these will be the parts of the urinary system. So once again, it's not complicated because we understand and we go through this process. See, processes that we go through, we try to understand them more. Well, the glands, we are not too familiar with the glands, all these internal processing that goes around our body, organ systems. But some of the things we kind of familiar when we talk about the testes, when we talk about the ovaries, when we talk about the uterus, when we talk about the breast, when we talk about the arms, the legs, the head, these kind of very big picture, if you will, then we understand a little better. But here we are getting more intrinsic, more inside. So that's basically what we need to understand. So this will be the major structures that make part of the urinary system. Of course, it's going to be a lot, particularly when we talk about filtration, reabsorption, and secretion. So as I mentioned before, location, we almost done. On the back, outside of the peritoneal cavity. So let's look at the picture because this is what you need to understand. The kidneys are not located within the chest cavity or the abdominal cavity. They are not. They are not part of the stomach. They are not part of the liver. They are not inside this membrane where all the internal organs are located. No, they are not. They are outside. So they are located in the back. So let's look at the picture right here. See, we have the two kidneys right here. We have the right kidney and the left kidney. So they are located right here on the back. Yes, we have ribs on the back. But then within the abdominal cavity in the front, we have a sac that covers all the internal organs except for the kidneys. So the heart, the lungs, they are in the chest cavity, remember. And these are like on the back of the chest cavity. And these are not within the chest cavity. So let's say that we're going to do a surgical procedure of the kidneys, remove the kidneys, do a removal of some type of fluids from the kidneys, just put it away. So we're going to work from the back through the ribs. If the kidney is going to be removed, it's going to be removed through the spaces in between the ribs. We don't have to go through the front because we're going to damage all these very important organs. So the kidneys are on the back. So always remember, we have two of them. Says right here, outside of the peritoneal cavity, which is the membrane that covers the abdominal cavity. So we don't have them inside there. They are outside. They are by themselves. When we divide, do a sagittal cut of the kidneys, we're going to encounter two layers, the cortex and the medulla. So remember the adrenal glands that are these two glands that are located on top or above the kidneys? Well, they have the same layers, but one is called the adrenal cortex and the adrenal medulla. That's a totally different issue. This is renal. Renal comes from kidneys. So cortex is the outer layer of the kidneys. The medulla, the inner layer or portion of the kidneys. It's the same thing. Because in each one of these parts, some actions are going to be happening. Something is happening within the cortex and within the medulla. So that's basically what it is. That's why we had to be very specific. If the layers didn't mean anything, like when we talk